Let's talk about, as the Director of Marketing, King's Daughters Medical Center, you've been here for a while now.
I have, coming up on 10 years this June.
And going through the pandemic was something that nobody thought that would ever happen. But I got to tell you, at the end of this thing, there are a lot of changes that are going to happen to just about every facet of industry. But hospitals are probably one of the top leads on that, the way things are done and what will go forward from here.
Yeah, there's been a lot of changes over the past year as far as our staff, as far as the way that we process patients when they're coming in. A lot of that's changed, especially in the clinical side of the things in our clinics. But the one thing that has remained steadfast, Paul, is the fact that we're committed to take care of this community. And, our staff, there's not a big enough shout out that you can give to our staff that's hunkered down and done the things that they needed to do during this pandemic to continue to take care of this community and do the things that we need to do. We started I think we were one of the very first hospitals in the state to start a testing site for COVID, and then also as soon as we can get our hands a hold of some vaccines, we lobbied for the State Department of Health to help us to kind of get these vaccines so that we could get the community vaccinated, and we're continuing to do them, and we'll administer vaccines tomorrow afternoon, actually.
Have you looked at the numbers, how you're doing as far as those over 65 or 55?
Yeah, we've done a fairly good job. Probably the first month or so we did it every Saturday, and we were probably administering somewhere in the neighborhood of 250, 300 shots every Saturday, and it was for those that were 75 and up, and then 65 and up, as the governor kind of laid that scale out, and we followed that guideline.
That's another thing as far as the being in a smaller community too, because people, whether it's in the church community or one of the nonprofit organizations or the Lions Club, whatever it happens to be, these folks know each other, and there's kind of a support group there to get this done.
It really is, and I can't tell you how many times we've been on the phone with people setting up appointments for vaccines that, while I've got you on the phone, let me go ahead and make one for my brother or my cousin or my neighbor, or you get someone that calls and says, all right, I've got 5 elderly neighbors, I need to get them vaccinated.
I don't know, and we're talking to David Culpepper, Director of Marketing. David, I don't know if you guys had statistics on the follow-through of that second shot. Did you guys get stats on that how many of the people got that second shot?
Everyone that we've administered has gotten a second shot at this point that were eligible to get it within the timeline, within the 28-day window.
Is it now available at the Walgreens? Or
Yes.
So there's no reason not to get it.
There's no reason not to get it.
You got a better chance of getting a shot than gas.
Yeah, actually, you really do.
I hate to say that, but
probably get it probably get the shot a lot quicker than you get gas.
Yeah, you wouldn't have to stay in the line as long.
Yeah.
Who would have thunk that? I know one of the big questions, and we're going to be talking to Alvin Hoover about this, is the move now is on for the petition drive for Medicaid expansion. Your thoughts on that?
I'd like to say it's Medicaid reform, a little different. Here's my stance on that is this. What we're doing is not working. We've got to change. I don't know what the real answer is, but I can tell you this: what we're doing is not working. And I don't know whatever anyone's stance is on that. You just got to look and go back and look that there was so much money put into it and taken out of it also for administrative fees. And there's got to be a better way to do this. So why not take care of the Mississippians instead of taking care of people out of state?
I do agree on this too, that every time we talk to people, whether it's one of the state officials at a statewide basis or even on a federal basis, everyone will admit that there's so much, not only fraud, but waste in the healthcare system. And I've always said that we could, when you start talking about that, you're literally talking to billions and billions of dollars. We could buy a Cadillac plan for everybody who doesn't have insurance, but there never seems to be enough of an effort centered toward that.
Yeah, and Paul, here's the thing. You've got to look that healthcare insurance has become so expensive and so taxing to those people that are making $12, $15 an hour or less that you can't afford to do it. So if they're going the route where they're uninsured, who's eating that?
Yeah.
The hospitals are. The healthcare facilities are.
There are two things that just seem to be indigenous of healthcare for the last 20 or 30 or 40 or 50 years. Not only is it expensive, it is aggravating as hell.
It is.
Through the billing process and everything else. And it's got to be as aggravating to the hospitals as it is for the patients, because that's not where it starts. It starts a lot higher with politics and insurance companies and et cetera.
Prime example, you get your EOB, your explanation of benefits, come in, and it says, here's the allowed amount. The average person thinks, well, the hospital went to bat for me right there. No, they didn't. That rate was pre-negotiated but long before you went in for that procedure.
And when you get that EOB.
Yeah, if you can understand it.
Yeah.